Great. Well, it is my great pleasure to introduce Dr. Emily Smith, a faculty member at Baylor University, whom I first met on Facebook as friendly neighbor epidemiologist, dispensing lots of wisdom about the COVID epidemic with wisdom and science and faith all intertwined, being gracious and fact-based all the time. It sounds like a high bar, but you are one of the people who provides a place of peace and sanity on the internet. So thank you for that, Dr. Smith.
Sure. Thank you.
Dr. Smith is also a woman of faith herself. She is a pastor's spouse. She is a Christian. She blogs. She's a global health advocate. And somehow she keeps answering the questions that keep coming her way. And so I'm delighted that she has made space for us to answer some questions and share her knowledge. So with that, I'm going to turn it over to you, Emily, because you have a lot more information to share than I do.
Thank you for having me. Such a pleasure to be here. It's International Women's Day. Did you know that? Women in Science Day. I know. So shout out to the ladies who are listening in ministry or science. So thank you so much for having me. We were laughing before we went live that I'm here in Texas, in Central Texas, and it feels like Wisconsin to us because it's 20 or 30 degrees. And y'all, I know but to Texas, that is cold here. So I feel a little bit of solidarity in that sense. Let me share my screen. I have just a few. There we go. If that is not showing correctly, then someone shout it out and let me know. But I am the friendly neighbor epidemiologist. I'm a global health epidemiologist, actually. So I do work with children who need surgical care in Africa. And so I do health equity work, but I'm an epidemiologist. And so what we do is we study populations and what predicts the spread of a disease or who is most at risk. So early on, this is a year, I was actually looking at what I was doing a year ago today, and I was speaking about some of my global health work, and we were just chattering, right, of the pandemic. And so people started asking me questions, just friends and family. And I decided I'll just start a Facebook page for 5 of them, which was my mom and mother-in-law and other people I could kind of get to join the page just to answer questions of what does it mean to flatten the curve. And I kind of thought, probably like the rest of you, that this was not going to last as long as it has, but unfortunately it has. And what we have seen too is that this concept of love your neighbor and being neighborly matters with a disease like with a virus like COVID for a lot of reasons. We protect one another. There's equity issues surrounding access to care and disproportionately affecting certain populations and others. So it was kind of natural from a health equity standpoint to start talking about the pandemic. And like they were saying, I am also part of a ministry family. I actually grew up charismatic. I married a Baptist pastor, and we go to more of a liturgical. So I'm not sure what I am at this point, other than I just love Jesus and love our neighbors. And so I wanted to frame today's conversation in that context. If you follow me on Facebook, you hear that verbiage of neighborly love being poured out, hopefully through most of what I write. And I hope that you see that as the common thread today when we talk about vaccines towards the end. Now, I want to also give a shout out as you guys that are in the ministry, goodness gracious, of how to figure out when to shut down and when to open up and how to mask, and you're asking questions about opening doors or closing doors and indoors and out. Oh, so I just love this. I don't know Father Nathan Monk, but I hope to meet him in person. one day, but there's a little bit of levity of keeping first things first in terms of how we can protect and love our neighbors. So for all you ministry families out there, I hope it makes you chuckle if you haven't seen this already. Very quickly about loving our neighbor again, we know that COVID, in terms of loving our neighbor, we know that COVID affects older adults in terms of the fatality of the disease and just how harsh it can be on a person's body. But when we talk about the love your neighbor, and to me, that's the Good Samaritan story. To many of you, it is too. Epidemiology to me is finding out who is most at risk and choosing not to walk by. That's where faith informs my science. And we know that that is the case with COVID with older adults, but we also know it's an access to care issue, urban versus rural, and also some ethnic racial minority issues of just who is being affected by COVID in terms of not only fatality, but infections and access to care. You will hear that when we get to the vaccine in terms of equity of who's receiving vaccines and who isn't too. So again, the Good Samaritan is the litmus test that we're going on. So in one slide, we've been in this a year. Sometimes we get stuck in the weeds to remind what COVID is and what it isn't, because I know there's so much information out there. It is a novel coronavirus, and so it is new. It is not the flu. Lots of chatter right now on my Facebook page of equating it with the flu. There's no way it's the flu in terms of how it spreads and the fatality of it and the comorbidities associated with getting sick. So not the flu. It also, now the other two pictures you see of how it is spread, this is where love your neighbor comes in the most and why masking is important, because people can spread this before they know that they are sick, or at the very beginning of the sickness where you might think it's allergies or just a sniffle. That is when you are most contagious. And so the proactive measures that we can take as people of faith and just as good humans, it's like my 9-year-old son says, to be a good human, is through masking to protect our neighbors. So what do we know about COVID? It's a new virus. It spreads and it increases exponentially. Instead of it being a 1 + 1 + 1, it's more of a multiplicative, which is why we see those pretty steep roller coaster increases. So this is where we are right now. I promise I'm going to get to vaccines in a minute, but I think we've been in this for nearly a year at this point, right? Cases are coming down. You can see there's a 35% decrease in cases over the past 2 weeks. This is from the New York Times. It's updated daily. Deaths are decreasing by 20%. Hospitalizations are decreasing by about 25, 26%. So that is good, and I want to celebrate the decrease, but the problem is where we are right now is still really high, which comes into play when we talk about vaccines in a minute. We still see over 3,000 deaths per day at least that are attributed to COVID. A study just came out from the CDC this week saying that 40% of those deaths are actually preventable. So a lot of deaths happening. So we need to keep that in mind. We're still averaging about 100,000 cases per day. So we're not out of the bad part of this yet. If you also look on the right-hand part of that screen of where we are right now with cases, we are still over the peak of what we were in the summertime when we really thought things were bad. So we still have a ways to go in terms of masking, keeping our distance, and doing what we need to do to get those cases even further down. And that's going to matter when we talk about variants with the vaccines in a minute. I also want to remind people that it's not just about dying. And I want to be very careful and empathetic when I talk about this, because I think all of us know somebody who has died from COVID, or know somebody who has a family member who did. So I don't want to gloss over just how hard those losses are. especially in the middle of a pandemic where mourning and funerals just look different. If you do not die from the disease, there is still long COVID that we need to be worried about. And that is this long recovery of months long heart palpitations or liver complications. Cognitive issues are beginning to pop up and be documented even more. So this is not something that everybody will recover from very easily. Some will and some won't. And it is really hard to figure out who is going to be affected by long COVID or not. If you look at some of the studies where they take into account a lot of people, which is part of epidemiology, is to look at the population-wide impact. Those who are affected with long COVID, the average age is 44, and most of them are women, which is a lot of us in our stage of life. So it's something you don't want this disease, and we need to worry about both fatality and also the long-term implications. And then I want to put this up just as a reminder, because I know pandemic fatigue has hit all of us in different ways. A reminder of our healthcare workers having to bear this burden of overwhelmed hospitals, of shifting staff, or of other staff just being sick, being just overburdened emotionally and mentally, that is still going on, and it will not end for a while, unfortunately. So we just need to be very, very aware and cognitive that, again, of those cases that are going down, that's a good thing, but they are not low enough where it really will elevate the burden off of our healthcare workers. So we need to keep that in mind. And the last slide before I get to vaccines, I put these two pictures from a faith perspective. As I told you before, I'm a pastor's wife, so we have not been into church, probably like many of you, since the beginning of the pandemic. We have had outdoor mass services, but that's pretty much it where we're going to church. I put these up because these are 10 hospitals that have gone up in 2 different places in the country. This is back in the summer when the brunt hit Texas and California. These are the 10 hospitals because of the overwhelmed healthcare systems. But at the same time, I knew that there were churches, big and small, rural and urban, who were still meeting indoors and unmasked. And so I just want, there's such a disparity, a disconnect between what is happening on the ground with our healthcare workers and with our neighbors being affected, maybe even in a different part of our town or city, that what we do in our churches matter. And I probably am talking to the choir at this point, but I just want to remind us that what we do matters. What we wear is a mask, and how we wear our mask in churches matter. Okay, so let's switch to vaccines. So for vaccines, there's a common thread of how these come into development through phases. And you probably have heard these phases already. It starts with phase 1, which is a very small group of people that they give the vaccine to, healthy individuals. And they basically just see, is it safe? Are there any weird side effects? And if you make it past phase 1, you go to phase 2 and you increase that pool to a couple of hundred volunteers. And you ask the same question, is it safe? What about the side effects? What about our body's immune response? And then you get to phase 3 and phase 4. This is when the numbers become in the 10, 30, 40,000 people that you give the vaccine to. And you ask the same questions. What are the side effects? Is it safe? But then you also look at long-term immune response, and is it protective against spreading the disease or not? So this trajectory of phase 1 to phase 4 vaccine development has been around for a long time. It is tried and true. It is legit science, and it is really difficult to get through just because the steps are so ordered. So I want to give you that as an educational tool if you hear any congregants or friends asking questions of if these were developed too quick. They went through the rigor of these phases, these tried and true phases, just like any other type of vaccine in a lot of people. So that brings us to date. Of the 2 vaccines that are currently issued for emergency use authorization, is Pfizer and Moderna. Both are 2 doses. Both require a second shot at either 21 or 28 days apart. And these are the ones that have gone through the phase 1, 2, 3, and 4 trials. In fact, Pfizer had 45,000 enrolled and Moderna had about 30,000 people enrolled in a lot of states in the US and then also in some other clinical sites internationally. But when you hear the emergency use authorization, that means that a lot of very smart people at the FDA and then at the CDC and then at the NIH look at the data among these 70,000, 75,000 people and look to see, are there any weird side effects? Is it safe? And did it actually work? Was it effective? And the data is so strong for both of these that yes, it actually does work really well in terms of reducing a person's chance of getting a very severe case of coronavirus. So let's talk, both of these are mRNA, which it's kind of a new it's new to us technology. It's not really new to the science world, but mRNA is different than some of the other vaccines that are that most of us have heard about and probably received. So what the mRNA does is it teaches our cell how to make what's called a spike protein. And I bet you have already heard this. It's a protein on the cell that once our body recognizes it, it teaches our body to these vaccines to recognize a spike protein and to mount an immune response against it. So the beauty of a vaccine is that our bodies will be primed against coronavirus if we actually come into contact with the real thing instead of just what was in the mRNA. So I tend to think about it like Bob Ross. If any of you guys are painters, you need 2 shots to make your body to make the vaccines work. The first one for both mRNA is to prime the body, is to get your body revving up to make those antibodies against coronavirus. And the second actually gives it the color. So think about it as prime and paint. It strengthens that immune response. So you really need to get both shots. We see a clear jump in immune and antibody production after the second dose. So if you hear anybody being hesitant to not get the second shot because they're worried about side effects or they just forget, then encourage them to go get that second shot. Now, side effects are common, especially after that second one, but they typically are very mild. And I think this is one of the biggest questions that I get on my Facebook site, is worried about the side effects because so many people are talking about it. But the side effects are like fever and headache. It's when your arm is sore from the injection site. A lot of it mimics side effects that you get when you get a flu shot or some other type of shot. So the second dose does mount more of a response, but it doesn't mean that you have COVID. It just means that your body is working harder at giving you some defense mechanisms. Okay, so let's jump into misinformation of vaccines. And I want to go over these kind of high level because there is so much information out there, and a lot of it is bad. So let me go over the big ones that I get questions asked about the vaccines. The first one is the mRNA vaccines in no way can give you COVID. They don't contain the live virus. There's no way it can trick your body into giving you COVID. It's just biologically, you just can't. You can't do it. They also do not affect our DNA. They don't change our DNA. They're not full of microchips. They're not going to alter anything. It's not a control mechanism. So if you hear that chattering, and I've seen some of the memes, even if it looks pretty legitimate, because some people can really twist that to make it look legitimate. It's not. There's just no way that it can change your DNA. The other misconception is, we've already talked about it a little bit, but that mRNA vaccines are new and the technology is new, and so it makes people fearful. That's not true, actually. The technology has been studied for other vaccines and also for other diseases, harkening decades back. So that it looks like warp speed happened with making these vaccines, but by the time 2020 happened, where we needed the mRNA vaccines, years before that had already been put into place to study these vaccines. Oh, here we go. Sorry, I was twisted on my my computer. Another misinformation are people worried about fertility. And I understand that. I have a 12-year-old daughter, so I, those questions are fine. And I'm a woman myself. There's not a way for this to affect fertility. It seems like the chatter around this has gone down, but about a month or two ago, there were a lot of questions related to mRNA actually making women sterile or affecting their fertility. And there's just no way that can happen. So that's just not true. And the last one is safety. So this is one of the biggest questions this week that I've gotten, and I think it has to do with, well, a couple of issues. One are the side effects and people being scared about it, and then two, some of the chatter around the vaccines being cause of death and fatality. We'll talk about that on the next slide. But I just want to remind everybody that the FDA reviews, and the CDC, the NIH reviews the vaccine safety information during the testing phase to a huge amount of rigor. To me, and now that I know a couple of people who are working within those trials, this is going to sound funny to say, but they're real people with real families. And so they want these to be safe because they know they're going to go to a lot of people. So if you hear any chatter about these vaccines not being safe or being a way to control, that's just not true. That's not the impetus of actually creating vaccines. It's actually just to save lives and get us out of this pandemic. Now, in terms of the vaccine safety, you are probably hearing more and more about the vaccines being related to deaths. You might see some of the memes about it, or there are some websites actually that are perpetuating that information, and that it's just not true. I want to highlight what you might hear if you hear that misinformation, which is the Vaccine Adverse Event Responding System, or the VAERS. Now, this is it's a system that is designed so that anybody who gets a vaccine of any kind can go and report side effects that could be or could not be related to the vaccine. So to give you an example, if you have a flu shot and the next day you come down with a horrible headache, then you can go into the VAERS and actually report that. It doesn't mean that it is causal, right? It doesn't mean that the flu shot gave you the migraine. It's just there as a reporting mechanism. What the job of the VAERS is to do is to go and investigate. If multiple people start reporting the same thing, then that raises a red flag and it's investigated. More often than not, those are not causally related. And that is what has been the case with reported deaths or other issues that are reported into the VAERS. So just keep that in mind. I've had a couple of people send me some reports that they have seen right now of, 35 cases in Norway of fatalities are related to the vaccine. Then there's another one that's 55 fatality cases, 55 people have died from the vaccine in the US. And that is not true. That's some data manipulation that is happening. And so just keep that in mind. I guarantee that if these vaccines are not safe, or if there's something fishy in the data or fishy in this reporting system, the CDC and the NIH and the FDA, Dr. Fauci, they are going to let us know that. There's nothing to gain by hiding or covering anything up. So I just want to assure you, because I know that you're probably hearing those reports, to just don't believe it. And I'm a little hesitant to say some of those groups because of some security issues, but just if Dr. Fauci doesn't say it, if the CDC doesn't say it, then really look behind who is saying the misinformation. I also want to point out something that from a pro-life, from a faith standpoint, is a really big issue when it comes to vaccines for many people. And that's the pro-life issue of using fetal cell lines in production. And it is really important to distinguish between fetal cell lines used in laboratory studies, fetal cells used in production or manufacturing. For the mRNA vaccines, there's no use of fetal cell lines in production and manufacturing. This is a very text-heavy slide that I have here for you. And I did that on purpose to show you from multiple faith perspectives of from the Catholic Health Association, the National Bishops Bioethics Center, the Vatican. Number 5 is if you are a Southern Baptist or more in the evangelical world. This is Dr. Russell Moore from the Ethics and Religious Liberty Commission from the Southern Baptist Convention. He actually did an incredible webinar with Dr. Francis Collins. If y'all don't know him, he is the director of the NIH. He's also a strong Christian. And they had this conversation about the morals of vaccines and fetal cell lines, especially as it relates to COVID. So I have that on my site if you want to watch that. But this is just a list of some that I found that are pro vaccines, pro the COVID vaccines, especially the mRNA ones, from a pro-life perspective. Okay, so I want to end and talk about where do we go from here? And hopefully I can give you some encouragement that there is an end in sight, because it feels like we're going to be in this forever. This shows the doses of COVID vaccines, at least one, that we are on track about 1 million a day. We are hoping that that will actually increase with more production. Johnson & Johnson goes up for emergency use authorization at the end of the month. And if that is approved, then that will also increase our numbers, that vaccine numbers that can be given out. So at our current pace, by July 2nd, you see that in the middle of the screen, we'll have 50% of the population at least partially vaccinated. And herd immunity is somewhere between 75 to 90%, will be more in the fall. Now, this is at current. A lot of things can affect this, especially if we ramp up production. But there is an end in sight, and herd immunity is our way. It's our only way out of this. It always has been. And there are 2 ways to get to that. One is natural immunity, which is just let everybody get sick at once, which we know is not the way to do it. And the second is this vaccination. To provide immunity that way. So I hope this gives you some hope that this will not be forever. I also hope that this next slide gives you more of we don't have a lot of time. We need to get vaccinated as soon as we can. So if you are offered a vaccine, if I am offered it, I'm going to take one. And of course, talk to your medical doctor if there's a medical reason why you can't take one over the other. But for most of us, it's the first one available that we need to take. The reason is we're now kind of in a race against variants. And you've already heard this, I'm sure. The new variants, the one in the UK and the one in South Africa, look to be more contagious or transmissible than the ones that we currently have right now in the US. What that means is that we are on that downslope of new cases, thankfully, but we can go up again really quick if these start taking hold. The UK variant is pretty widespread in certain smatterings across the US right now. The problem is the more variants that we get out there, we run the risk of the vaccines possibly not working as well as what they do right now and making it lower effectiveness. Now, the vaccines, we can get a booster shot to cover that, but it always becomes a race to make sure that people are protected. So my advice is to get whichever vaccine you can, unless your doctor tells you otherwise, whenever you can, to outpace these variants and get to herd immunity quicker. Now, from a faith standpoint, I want to end with maybe what to do as a church and as a congregation. First is get your vaccine when you can. And the second is it's a good idea to double mask. There's a lot of chatter around this, but you see Dr. Fauci with his cool penguin mask. To double mask, that a CDC study just came out that it can reduce your risk by over 90%. So you want a tight fit, you want to make sure that it's certainly comfortable, but get a good mask to wear underneath a cloth one that you can wash. And then for you clergy, I know that you are probably asking questions on when can we open up again? When can we meet outside? Like in Texas, that might be in a few weeks when weather gets a little better. If you have not seen this, this is the Path to Zero that Harvard put out. And it's my go-to metric on where are we in terms of spread. I would not recommend opening up until you are at that lower end of the accelerated spread of 10 to 24 cases per 100,000 people. The best bet is wait until we get to 1 to 9 cases per 100,000 people. And if you need help figuring out where you are, wherever you are in the country in terms of green or yellow or orange or red, I have those resources on my site. So you can just plug in your zip code and find that out. But I would use this and I would watch really carefully to see what the variants are going to do, because we can go right back up pretty quickly. And the last thing, just from a faith standpoint, is you have heard, like I have, of these chatters of wearing a mask is a statement of fear. Or it's taken away our liberty. And I just want to flip that switch, that it is actually a statement of loving our neighbor. It's a statement of having faith that God will take care of us. He is in control. And I have a way to do what Galatians 5 says, of using my freedom to love and protect one another and to serve one another in love. So those type of conversations still need to happen until we can actually reach herd immunity. So I just want to encourage you, if you've been saying this for a long time at this point as clergy, to just continue to say it, especially with the risk of the new variants coming out. And then from clergy, my number one question that I get asked is, if schools are open or restaurants are open, or I can go to a sporting event, then why shouldn't I be able to go to church in person? And that is a good question. I tend to answer that by the perspective, though, is we live according to the kingdom. We live according to be chosen people, a royal priesthood, and a holy nation. And so I just want to encourage that if you are asking that, or you get asked that as clergy, to go one step further of, well, what leadership do we follow? And that is the leadership of being a royal priesthood under God. And so that can be summarized in my question that I've asked for months, is what if Christians led the way out of this? What if we went one more step than what the rest of the world might be doing, just to show that we actually are part of a royal priesthood, part of a different kingdom than what what other people might be seeing right now. I have this is a CDC website where I got a lot of these slides and information, but it is a great resource. They've really revamped it and included a lot of of good congregate related resources or healthcare personnel related resources for you if you need it. So thank you for having me. I'm going to stop sharing.
Thank you so much, Emily, for what you've offered us today. I'm going to invite people to share their questions in the chat. We've already got one question that's come in, and we'll continue to take them as they come along. Are you ready to go?
I am. It was so much information. So
Great.
thank you for staying with me.
The first question is actually about double masking.
Oh,
The person would like to know how 3-layer cotton masks with a 5-layer carbon insert compare to wearing a surgical mask with a cotton mask over the top.
goodness, that's a good question. I usually, I'm a researcher, so I like to prepare for those type of things beforehand. Oh, let's see. Did I answer it? There we go. 3-layer cotton mask with a 5-layer carbon insert compared to wearing a surgical mask. Okay, I see. I have been advised that if you wear a surgical mask, the ones that are pretty readily available, to wear that and then wear a cloth over it. I think this question is asking about 2 cotton types. Mm-hmm. So I would advise getting the surgical mask or KN95s or the new 94s that are available, getting those and then putting a cloth over it. Mm-hmm. Especially with the variants, the new variants coming.
Right. The biggest question we often get is about singing, and we've been very consistent in what we've heard on singing. Are you hearing anything different or more hopeful?
Oh man, I wish, but no. This was one of my first webinars months ago, was about singing and the projection and the risk of it. So no, I haven't heard any different.
Okay.
Yeah.
I received a question from a clergy person the other day asking about when we might expect vaccines to be available for children and the younger children particularly. Do you have any expectations on that?
Well, I heard from Dr. Fauci on his daily briefings that he gives that for most of the population, 18 and older, 16 and older, for some of the vaccines, it will be readily available by the end of spring or early summer. For children, some of those, and I can't remember the lower part of the ages that are in the trials right now, but there are trials looking at this around the country. So I would assume that we would have that data that would be available for kids at least elementary and older by September. That's going to be a little bit.
Okay.
Yeah.
I'm wondering if you have handy the URL for your website. Folks are asking us to put it in the chat.
Oh, no, but I can get it.
Cool.
This is real live TV, isn't it?
It is.
I can get it.
And multitasking all the time.
I know. If my kid photobombs in here, both of them, then that's just where we are.
We've had babies, dogs, cats, you name it. So.
I love it. Okay, here's the Facebook one. And then I can put, I have my website.
Great. Questions come in. We have a lot of misunderstanding of how quickly we can resume close contact since vaccines are being given. Is there an effective graphic or simple image you might recommend for newsletters?
This is post-vaccine, when you can go visit.
Yeah, how long to wait, etc.
I do not know one, but that would be very useful, wouldn't it?
I wonder if folks' county health departments might have something.
Maybe. Yeah. The CDC actually might have something because they have some great graphics that I have found.
Mhm. I'll check that out from our perspective as the council. And if you follow the WCC on social media, or if you subscribe to our newsletter, we'll keep tabs on that. And if we find any handy graphics, we'll pass them along. There's a question about, once vaccinated, can I still pass along the virus?
Yes, that is a question that all of us are asking, because we don't know yet. We know that if you get vaccinated, that you are protected against severe disease for sure, or hospitalization and death. What we don't know yet from the data is whether or not you can actually spread to other people and be asymptomatic. That data I expect to be in by the end of the month. And so many of us are watching, because that is a critical question to decide, when do we go out and about and who do we go see? But for now, we just don't know, which is why you hear so much around, if you get vaccinated, you still need to wear a mask. So keep doing that. Don't take your mask off until we know.
Okay. You've said those side effects we might expect with, especially with the second
Right.
shot, are actually a good thing. It means our immune system is doing what it's supposed to do. It is it helpful, unhelpful, doesn't matter if we take meds to reduce how we feel.
Yeah.
Related to that, bring down the fever or reduce the pain or anything like that?
That's a great question. I have heard, and I'm not an MD, so certainly check with your MD. I've heard to avoid taking ibuprofen or acetaminophen prior to the vaccine. But then if you're feeling, feverish or achy afterwards, later that night or something, then to go ahead and take it.
Mm-hmm. I received a question from some of the religious leaders earlier this week, and this is echoed by one of today's attendees, about whether we'll actually be able to reach herd immunity given the number of people who are not planning to get vaccinated and who are really concerned about it. Do you have any comments on that?
I mean, I think a lot of us are worried about that, of remaining in this cycle for longer than we should, because we can't ever reach herd immunity. But I'm not sure if those that are not going to get the vaccine are actually a large proportion. I certainly think that it's loud, and that's fine. I'm not, knocking the questions or anything, because that's okay. But I do wonder if it will prevent herd immunity. So the last day that I looked at, there are people who are not against the vaccine. They're just waiting their turn. So maybe I'm too much of an optimist, but I'm going to be hopeful that people are going to get it. Especially with the J&J, hopefully coming out, that's a different type of virus than mRNA. So it feels like there might be options to help us get to herd immunity.
We had a meeting on Monday where one of the medical experts speaking with us talked about the idea of vaccine champions. Can you in your community really be an advocate for it?
Yes, and I think that is a huge role that the church can play. And so I've kind of pivoted my response to, when I talk to a lot of pastors groups, of this is a way for us to collectively love our neighbor, again, and protect those who can't protect. So I think the church can lead the way. When I think too of the partners that I worked with in some of the more remote rural areas, some of those communities have been very disproportionately affected, and the vaccines are not getting to them. So there's an equity issue there. And I think churches can be a spot of almost like what do they call that? I can't remember, almost like a campaign of, we're going to march and go get our vaccine, or be the hub of a vaccine distribution center. Because really, when you think about it, the church for many of us is one of the most trusted spaces. It's a holy space. It's a sacred space. And so I think that the verbiage around vaccines and loving our neighbors from a faith perspective can be really powerful to get us out of the pandemic.
Speaking of loving our neighbors and, loving the littlest ones among us, right? Jesus put them right in the middle. When we regather for worship, nursery care is going to be a concern.
Yeah.
Do you have any thoughts on how we might accommodate that and do that in a safer way, dealing with small children, babies, childcare workers, nurseries, all of those concerns that churches might have?
Yes, that's such a great question for our little bitties that we want to love and take care. I will try to find it while we're talking here. There is I think it's Saddleback Church joined with another fairly large faith organization on how to do these type of things. And it's very minute, even of how do you clean the bathrooms and some guidance around that. So maybe I can find that and post it in the link.
Okay, that
Yeah.
would be great. Somebody asked if you could talk a little bit about how the Johnson & Johnson vaccine is different from the two that are already approved.
Yes. Oh, for sure. The J&J vaccine is one shot. It doesn't have to be stored at such low temperatures. So from a logistics standpoint, it's really great, especially in my world where I do global health and you need those type of one shot, easy to transport type vaccines. So that's one of the biggest pluses. Another one is it's a different type of vaccine where it's not the mRNA technology, it's an adenovirus technology. So the mechanics of that are certainly not my specialty, but the data that goes up for emergency use authorization around J&J has pretty much the same safety profile as the mRNA ones in terms of side effects and even in efficacy. So it differs a little bit in terms of logistics, but in terms of how well it works as a vaccine option against COVID, it's really great.
Okay.
And the same, I'm not, maybe I couldn't tell if this was part of the question, but all of these vaccines go through the same approval process, same rigor, same FDA, CDC, NIH panel. And these panels are independent scientists, and you can watch it live. I watched them just because I'm nerdy like that. And to me, they're fascinating because they go over every little line of that 93-page document to actually assess, is it safe or not? So the same thing will happen for J&J.
Nice. We had a great question about human nature and not specifically science. And I think this speaks to the role you've taken on as friendly neighbor epidemiologist. Suggestions for confronting misinformation and going in and saying to somebody you're wrong isn't always the most helpful way of dealing with it. Do you have any suggestions for an approach to teasing that open?
I mean, I think if you can just have a conversation with it and, there's nearly 70,000 people on the site at this point, and most of the questions come from a good heart, not all. And I think discernment is to be used on what are they actually asking and the motivation behind it. But in terms of confronting misinformation, that's why I try really hard to give people the tools of, if you heard this about the vaccines changing your DNA, where did you hear that? And look behind the websites. Most of these sites look independent. They're sneaky, but they're not. There is an agenda behind it. So I think when you can equip people to recognize that, it helps, dispel the misinformation. But I also think the more conversation we can have with people the better. Because if you talk combatively, they will probably talk combatively against you, and then no one wins. That many of us, there's nothing that we profit from. We don't win anything other than helping people stay safe and healthy. So I think it's, I don't know, maybe just being a friendly and neighbor, but also to know the time when it is time to call out misinformation of what it is, and just say that is not true. And I think that pastors have a specific role, and I'm not saying to do that from the pulpit, but I think they have a unique role to help people, be guided into truth that will affect their communities.
This isn't COVID specific, but it may be helpful to some of the people in the audience. One of our upcoming webinars is on March 16th in the evening. It's on pastoring in the age of conspiracies and disinformation. We're co-hosting it with the Clergy Emergency League, and I don't think it's just for pastors. I think it really speaks to anyone in church leadership who wants to be effective in sharing factual information and building community in an environment where lots of people are conveying what they understand is truth that they've received from varying sources.
Yeah. And it's the courage to know when to say what is not true. And for a lot of us, that is new this year. I think that some people are really good at calling it out and being bold. For other of us, like me, this is new to say what is right and what is wrong, to try to do it friendly as much as I can, and through what I hope Jesus would would do as well, but to call out inequities as well. And I think for something like COVID, this is an issue of justice to a lot of our neighbors. You think when a family has to make a choice between going and getting health care or putting food on the table for their children, which is a common problem with COVID in some of these very disproportionately affected impoverished communities, they have to make that decision, and not all of us have to make that decision. So that issue of justice and loving our neighbors makes me more courageous in calling out the misinformation, because if they get sick versus some of the other community members get sick, there's an equity issue on healthcare. So that's another thing to keep in mind. I think just to be bold as much as you can, and then there are some conversations to just leave. Leave it as it is.
It takes a lot of discernment and a
Yep.
lot of courage to live through these times, but remembering that we're not alone also goes a long way.
And I don't want to be silent. I don't want this part in history that I didn't do everything that I could to help love our neighbors. And that I think that a lot of us are having to make those choices of how do we do that verbally, and that's at a cost. I know many clergy have had a cost to this pandemic because of stands that they've taken, and I understand and I get that, but those will not go unseen at the end of the day. So I hope that's encouraging.
Emily, you have been generous with your time and your knowledge, and I want to thank you so much for bringing your science hat and your faith hat and your collegial hat to us today.
Thank you for having me. Thank you. This is, gosh, what a place in history for us to be the hands and feet of Jesus. So I thank you for having me. Solidarity, sister.
Many blessings to your ministry and all the places that it's in action. Blessings to all of you on your ministry. You can find the recording of this webinar on our YouTube page within about a day or so. It'll be available on the coronavirus menu. Dr. Smith, would you be willing to make your slides available to us so we could send them out to attendees?
Oh yeah, that's great. That's a way to get the websites too. If they have a question where the data was, I'm happy to do that.
Great. You send them to me and I will get a PDF of them out to those who registered for today.
Excellent.
Super. Have a great day. Take good care, stay healthy, and wear your mask.
Yes, that's right. That's right. Thank you.
Okay. Blessings.